Begin by mentally dividing the gravid uterus into 4 quadrants and then adjusting the depth setting to maximum. To examine for fetal presentation, begin with the probe in transverse at the symphysis and locate the maternal bladder. If you do not see the bladder, slide the probe cephalad. Once the bladder is identified, slide cephalad into the gravid uterus. The next structure you should encounter is the fetal head. This will be ovoid and have bright echogenic walls. Once the fetal head is located, the next step is to follow the fetal spine. Locate the spine as it arises from the head by rotating the probe from transverse into longitudinal while watching the fetal head on the screen. Do this slowly. If you don't see the fetal spine, slide the probe to the right or left of midline to find it. Once you locate the spine, slowly slide the probe along the fetal spine in a longitudinal orientation. You may need to adjust the angle of the probe off of a purely longitudinal orientation to follow the spine. Once you have reached the end of the spine, perform a sweep to ensure that there is no other fetal structure in the area that resembles a fetal head. At this point, you will have assessed the fetal head and spine in 2 of the 4 uterine quadrants. The next step is to assess the remaining 2 quadrants. Slide the probe across the abdomen into the other upper quadrant and then down into the remaining lower quadrant. Ensure that you do not see another fetus. This maneuver should have taken your probe completely around the maternal abdomen, and at this point you should be able to identify the fetal presentation.